name is Tiffany Jasperson, and I'm the director of the Clinical Performance Lab for Seattle University College of Nursing. This video is an introduction to simulation as it is experienced by the undergraduate and advanced practice nursing students. According to the Institute of Medicine, approximately 100,000 patients die in hospitals each year from medical errors, and 72% of these resulted from communication errors followed by poor patient assessment and inappropriate clinical action. Simulation allows students to practice not only technical skills, but communication techniques so that they can learn how to best deliver patient care. Throughout this video, we will demonstrate the simulation process and address some of the prominent issues contained within the current literature on the topic of simulation experiences in nursing programs. As you watch this video, ask yourself, does simulation enhance learning, and what specific aspects enhance learning? How much realism or fidelity is needed to obtain the best outcome for students? And how much facilitation before, during, and after simulation is needed from the instructor for optimal learning experience for students? Following this video will be a short clicker facilitated session. Enjoy! Is a 62-year-old school teacher. Today he presented to the ED with worsening symptoms indicating an acute exacerbation of heart failure, and he's been diagnosed with dilated cardiomyopathy. His past medical history includes type 2 diabetes mellitus, angina, coronary artery disease, and congestive heart failure. He currently is experiencing a weight gain of 9 kilograms in 2 months and currently is experiencing severe dyspnea, bilateral crackles, and feels as if he's going to pass out. Diagnostics performed in the ED show cardiac dilation, pulmonary edema, and atrial fibrillation with occasional PVCs. We're currently in the coronary care unit at Seattle Grace, and he will be transferring from the ED to the unit.
Okay. Hi. Hi, I don't feel right.
Hi, Joe.
Hi.
My name is Jean, and I'm Ilona. We're going to be your nurses for today. Okay? Can you state your name for me?
It's Joe. It's Joe Grice.
Okay, and your date of birth?
It's March 30th, 1951.
Okay. Joe, I'm just going to lift the head of your bed up a little bit.
I can't breathe.
Okay. Yeah, what's going on? Can you tell me more about that?
I don't know. I can't breathe. I'm really hurting. I feel like I'm really in trouble here.
Yeah, what's hurting you?
My chest.
Your chest?
Yes.
Okay.
It's bad.
Can you point to where it's hurting?
I can't breathe.
I'm just gonna put some oxygen on you, Joe. Okay, this is gonna help you breathe a little bit better.
Okay.
All right. So can you tell me why you're here today?
I started having a lot of chest pain. I just can't even breathe.
Okay. All right. Let's look at the vital signs. His oxygen is still really low, and his respirations are really high. So maybe just based on his vital signs, let's take a look at his orders, and should we come up with a plan of care? Okay, Joe, we're just gonna figure out what we're gonna do for your pain, okay?
Okay. So he has morphine 2 milligrams IV ordered, but I noticed that his blood pressure is low, and it's not indicated for less than 90.
Good.
We should not give it. So we probably can't use morphine for his pain.
Okay.
The nitroglycerin we could give him, but you know it's a vasodilator, so his blood pressure is low. That might be a problem.
Right.
So it kind of limits our options for his pain treatment.
Right, and it's hard to know exactly what his pain's related to. We can't totally rule out cardiac because of his rhythm, but so we're just gonna want to keep in mind, you know, what his pain's about. Can we check and see if he's gotten his aspirin yet?
Yeah, he's gotten all his PO
okay,
medications
wonderful.
already.
All right, so then do we want to go ahead and administer his nitroglycerin, and then let's see if he has any, since his blood pressure is kind of low, let's see if we can help his heart rate out with this Jackson, since his heart rate is above 60. This is IV now. So let's start with the nitro, and then I can go ahead and start the assessment, and then after the nitro, we can maybe do the digoxin. Does that seem like
Okay,
an
sounds
okay plan?
good.
Great. I'm going to continue with my assessment. Can you state your name for me?
It's Joe.
Okay, and your last name?
Grace.
Okay, and what is your date of birth? Listening to the heart.
March 30th, 1951.
Okay, thank you. I have your nitroglycerin tab, and I did my 5 rights of medications.
Okay, just kind of
Here it
continue to
is.
check capillary refill.
So we have digoxin, 0.5 milligrams IV, stat. So I'll be giving that now. Doing my 30-second rub. I'm going to do a saline flush. Okay. There's no resistance, so I'm going to give the digoxin now. Keeping it sterile. Okay, and push it over 5 minutes. And now I'm flushing it with normal saline again.
Joe, how you doing? Joe?
Very good.
You doing okay?
I don't feel very good at all.
Oh, I'm sorry. You still having a lot of pain?
Yes. This is pretty scary. Do you think I'm going to be alright?
I hope so. We're going to do the best we can. We just want you to let us know if, you know, anything changes, and I'm really sorry that you're not feeling well and that you're in a lot of pain. That must be, I can understand that that'd be really scary. So,
Yeah.
we just gave you some nitroglycerin and digoxin, and I just wanted to let you know that it looks like your heart rate is coming down a little bit. It's still a little bit high, and your blood pressure is coming up a little bit, and if it stays up, maybe we can give you something for your pain, okay?
Oh God, I hope so.
Coming in. Hi there.
Joe, this is Amy and Allison. They're going to be taking care of you for the next shift.
Hi Joe, my name's Amy. I'm one of your oncoming nurses, and this is...
Hi Joe, this is Allison. I'm also going to be coming in and helping you out.
Hey.
So we're just gonna do a hand-up report where we just talk about what we've done for you during the shift to your new nurses, okay?
Alright.
So just to kind of quick brief you a little bit about him, Joe came into the emergency department just with a lot of chest pains, difficulty breathing, and he has some important past medical history of diabetes and cardiomegaly. His ejection fraction has been really up, and we're just a little bit concerned about some heart issues that he might be having, as well as respiratory issues. Like Alona said, we started off with giving him the digoxin and nitro because his blood pressure was just really low, and his, as you can see, it's improved. We haven't had a chance yet to get his labs done or his ECG, and I just started his assessment, and I started his lung sounds, and they were pretty diminished, and he had some crackles in his right side. So I would just recommend continuing his assessment, watching his vitals. He was complaining of a lot of difficulty breathing and a lot of chest pain. So do you have any questions or any clarifications you would like to ask at this point?
Did you mention whether or not he received Lasix at all?
That was the previous shift, and so he's due for his next medications. The Lasix, the first one, and Lexapro.
Yeah,
Okay.
Any other questions or
Okay.
thoughts?
We're good. I think we're good. Is everything covered, Joe?
Yeah, I think so. I think they know me well.
Joe, it was really good working with you. I'm really sorry that you're not feeling well, and we just hope you feel better, okay?
Thank you so much. I really appreciate all you've done.
Yeah, take care, okay?
Okay.
You're in
Bye,
good
Joe.
hands.
Bye-bye. Thank you so much.
Bye, ladies.
Hi Joe, this is Allison, you're a nurse. How are you doing?
Oh, not so great, Allison.
Not so great. What's going on?
Well, it's just been a really bad day, and it's kind of scary being in the hospital.
Yeah, it is a little bit scary here. And we're here to help you feel safe, okay?
Alright.
All right.
Have you heard from my daughter?
Not yet. I haven't. Has she on her way?
Yeah, the last nurse has called her, but I haven't heard about her.
Okay.
coming in yet.
Okay, well, we'll keep an eye out for her. And if we see her, we'll let her know where you're at, and we'll direct her
okay.
to you. Sound good?
Thanks, Allison.
Okay, all right. Well, I'm gonna continue on with the assessment the other nurses were doing. They left out on listening to your lungs, so I'm gonna kind of listen to your heart and check your skin out and kind of move from the head down to your legs. Is that okay with you?
Sure.
Okay, all right. So I'm gonna start with listening to your heart.
All right.
Allison,
Yes.
it appears that we're starting to get some PVCs on Joe's telemetry.
Oh, okay.
This is Dr. Smith.
Hi, Dr. Smith. My name's Amy. I'm the nurse caring for your patient in the CCU room 4, Joe Grice. So
I'm familiar with him.
Thank you. He's continuing to fail to respond to our interventions. He's a 62-year-old patient with a history of cardiomyopathy who came into the ED with acute congestive heart failure. And despite the Lasix and the digoxin, his BP is not responding and he's showing signs of increased work of breathing. I'm concerned that he needs further interventions and that he's going into respiratory distress. I'm hoping that you can come in to look at him.
Well, I'm in a meeting right now. How about a half an hour?
You know, I really am concerned for my patient, and I really think that the best thing would be if you could get in here as soon as possible.
All right, I'll swing by.
Thank you so much.
Hey, Joe, you there?
Here.
Joe.
Hi, Joe. We're just going to switch your oxygen right now. Some mask going on. How's he doing?
Amy, he's gone into VFib. Holding code.
Gonna get the AED.
Dropping bed. Starting compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15 and 16 and 17 and 18 and 19 and 20 and 21. 21 and 2, 3, 24, 25, 26, 27, 28, 29, 30. Rest.
Thank you so much for taking the time to watch this film. We sure enjoyed filming it for you, and we hope that in the future you're able to take some things away from this film and use it in your own programs.